Hello, I'm Dr. Jeffrey Desarbo. I'll be going over this course, which we'll break up into several sections. I want to thank everyone for coming today. We'll get started right away with the definitions of eating disorders according to the DSM-4 as they currently exist, although the DSM-5 is also under revisions right now for final publication. And when those become available, we'll make you aware of any changes and updates that were made to these definitions for eating disorders. So let's get started. We're going to cover bulimia nervosa, anorexia nervosa, and eating disorder NOS, which are all currently included in the DSM-4 and defined there. It's important in general to remember about eating disorders that it is a serious medical psychiatric condition. It has the highest mortality of any psychiatric condition. Approximately 10 to 15% of people with anorexia and bulimia often can die from these disorders. 50% are usually by suicide, 50% by medical complications. If you look at the prevalence, you're looking at bulimia nervosa has approximately 1 to 2% that can meet full criteria as defined by the DSM, although 5 to 10% of the population often is reported to have some symptoms of bulimia. And in a recent study I read about college females, up to 17% of college females seem to be currently exhibiting symptoms of bulimia nervosa. As far as anorexia nervosa goes, again, it's a percentage of 1 to 2% of the population. It has more medical complications associated with it due to times of it, severe malnutrition that can go along with it, and complications across all physiological symptoms in the body. People with eating disorders, about 70%, also have a coexisting psychiatric disorders such as depression, anxiety disorders, bipolar disorders. 20 to 30% of people also have substance use issues, alcohol, pot, other types of illicit drugs. And so it's not a clean condition to be treating. You really got to go into everything that's going on. Okay, we'll start with bulimia nervosa, which is defined as having recurrent episodes of binge eating. And the binge is actually characterized by 2 criteria: eating within a discrete period of time, which is usually defined to be about 2 hours in the DSM-4, an amount of food that is definitely larger than most people would eat during a similar period of time and under similar circumstances. A very general description. There's no quantitative measure on that. So there's some subjectivity used actually on this criteria, which makes it difficult. There's also the person experiences a lack of control. They feel that they have no clue what's going on while they're eating. They often can't remember how much or for how long they ate or exactly what they ate. They may feel that they've been in a zone. Nothing was distracting them. They were just consuming food left and right. Compensatory behaviors are necessary for bulimia nervosa. These can, most classically, you're looking at things like vomiting, misuse of laxatives, diet pills, excessive exercise, medications, enemas, fasting. The binge eating happens, there is a time frame for it. You need at least 3 months of continued episodes that occur at least twice a week. If this criteria is not being met, you're looking at a diagnosis of eating disorder, NOS, for the time being. And self-evaluation is unduly influenced by body shape and weight. And the disturbance does not occur exclusively during episodes of anorexia nervosa. This is an important exclusionary criteria because, as you'll see, there are 2 types of both bulimia nervosa and anorexia nervosa, and I think people forget about this a lot of time. With bulimia nervosa, you have the purging type where one regularly engages in the self-induced vomiting or the misuse of diet pills, laxatives, meds, or enemas. And this is what most people think of when they think, someone has a binge and then they go throw up. That's classic. But there is also the non-purging type where one may have periods of binges, but then they do not eat for the following day or 2, or they engage in excessive exercise rather than the purging exercises that you will see, such as vomiting, the use of diet pills, laxatives, or medications. With anorexia nervosa, to meet full criteria, you also According to the DSM, there is the refusal to maintain body weight at above or at a minimally normal weight for a person's age or height, or a weight loss that leads to the maintenance of body weight less than 85% of that expected. And for children and adolescents, there's a failure to make expected weight gains during a period of growth. And that also leads to 85% less or less expected what should be found on the growth charts. There's an intense fear of gaining weight or becoming fat, even though by definition they are underweight. There's a significant disturbance in the way one experiences their body weight or shape, and there's influence on how they evaluate their self is significantly, although, many people are aware. It's not that everybody with anorexia looks in the mirror and sees themselves as being fat and significantly overweight. Some people do have better accurate perceptions of what they look like. But there's also, in those situations as well as those who see them as fat, there is a denial of the seriousness of their current low body weight. There's a sense of invincibility, that nothing bad will happen to them. And in postmenarcheal females, there is amenorrhea, which is the absence of at least 3 consecutive menstrual cycles. And a woman's considered to have amenorrhea if a period occurs only if there's any hormone replacements, estrogen, or taking birth control pills. So if they are on hormones, birth control pills, and they're getting their menstrual cycle, technically it is still considered to be experiencing amenorrhea. Although this specific criteria is being considered to be eliminated in the current DSM-5. We'll have to wait and see what comes out in that. So just like bulimia nervosa, there are the 2 types. And classically, people think of the minimal caloric intake of food. The person doesn't eat much. They have intense fear of gaining weight. And they could have calorie counts as low as 300-400 calories a day, sometimes 0. And it's all an attempt to control weight. But there's also the binge eating purging type, which people often forget exist, where it looks like it's a combination of bulimia and anorexia. And I know even on TV some popular people start saying, oh, there's a new term, bulorexia. Well, it's not. It's really anorexia, binge eating type. And this is where somebody still meets all the following, the criteria that exist for anorexia nervosa, but they can actually engage in binge eating and purging behaviors. So eating disorder NOS exists when there's not enough criteria to meet the full criteria for either anorexia nervosa or bulimia nervosa, and can include certain types of things. For instance, if someone has anorexia nervosa, but their menses is currently on a regular cycling basis, or that they have anorexia, they meet the criteria except that their weight is still within the normal range. And since the eating disorders kind of slide on a spectrum, you can have people going back and forth between anorexia nervosa, bulimia nervosa, to binge eating disorder. So criteria for bulimia can be met, except you may have, again, occurrences less than twice a week or duration less than 3 months. So if someone comes in, they just say they need treatment because for the past week or 2 they've been binging and purging. That can be because for many acute stressors, they're going to be diagnosed at that point with eating disorder NOS and not bulimia nervosa. And if there's inappropriate compensatory mechanisms for normal weight people, kind of like dysfunctional eating patterns. They eat a couple of cookies and they induce self-vomiting, but they really are not meeting full criteria for either anorexia or nervosa. Classically, there are some other examples: repeatedly chewing and spitting out food but not swallowing it. Again, more of a dysfunctional eating pattern. Binge eating disorder, which may be included in the new DSM-5 that's coming out, which is when you meet the episodes of binge eating, but there's no compensatory behaviors that you see in bulimia nervosa. And night eating disorder, which has become popular since about 1999, although originally reported in the 1950s, waking up at night, eating large amounts of food. Again, not meeting criteria of anorexia nervosa, but still